So I am Jess Mazarek. I'm in the Office of Data Science Strategy, and I'll tell you more about that office in just a minute. And I am leading several efforts in NIH's data science workforce and training program portfolio. And I'd also like to turn it over to my colleague, Phil Ryan, for him to introduce himself.
Thanks, Jess. My name is Phil Ryan. I'm the Deputy Director for Graduate Programs and Student Services within the Office of Intramural Training and Education at the NIH. And I'll tell you a little bit more about our office and some of the ways that you can train at the NIH and bring your data science skills here.
Thanks, Phil. So Phil and I will be giving this talk together today, and I'll just start with an overview of ODSS. Can you go to the next slide, please, Phil? The Office of Data Science Strategy sits really across all of NIH. So NIH is made up of 27 institutes and centers, and each of them are doing their own really important mission-dependent work in different mission areas and different disease areas. And so what the Office of Data Science Strategy does is we come in and we try to work with them to help support data infrastructure, data ecosystems, and provide opportunities and resources that really do cross all or many missions and institutes and centers. And so we're doing these activities under the Strategic Plan for Data Science. You can learn more about this on our website, which is linked there, but we're really trying to build a modernized, integrated, and fair biomedical data ecosystem under the strategic plan, and to make data findable, accessible, interoperable, and reusable. And we're doing this by covering 5 goal areas: data infrastructure, data ecosystem, tools and analytics, community engagement, and workforce development. And Phil and I are going to be telling you about some of the workforce and development programs today. So I just mentioned that we have a strategic plan for data science, and these are the goals and objectives again here. And again, we're going to be in the workforce development column goal, and talking about enhancing the NIH data science workforce. So basically bringing people into NIH with data science and related expertise to work with us in our offices and labs. But I would also like to note that there are other really important aspects to workforce development, including expanding the national research workforce, so data science and biomedicine more broadly, and engaging a broad community. Next slide, Phil. Hey, Phil, can you switch the slide?
It switched on my computer.
Oh. Uh-oh.
I see goal 4 activities.
Try to stop sharing and share again. That's worked in the past.
Did that work?
No. I want to make sure I cover everything here. Let me just pull the slides up on my end too. Sorry, everyone.
Aaron, are they advancing on your screen, or is it just not mine that's working?
They are not advancing. I am going to try to pull up your slides, and then
I can share too. I have them open right now, if you would like.
Okay.
Want me to try?
Sure.
Go ahead. I stopped sharing.
Okay.
And if you've joined us, we have Phil Ryan and Jess Mazarek presenting about data science workforce and training programs. Thank you for your patience, and thanks for being here.
Oh, that's not what I wanted. Okay. Oh, geez. All right, so I just mentioned that we're under Goal 4, activities to enhance the NIH workforce. And today we're going to be talking to you about 3 different programs: the Civic Digital Fellowship that we run in collaboration with Coding It Forward, the Data and Technologies Advancement National Service Scholars Program, and then Phil will be talking about the Graduate Data Science Summer Program. So first, I'll tell you a little bit about the Civic Digital Fellowship, and this is our summer cohort pictured here. The Coding It Forward group is a student-led nonprofit that places tech-savvy students in federal agencies. And so over the summer, we had 16 students in admin or funding offices. So just to step back for a second, NIH is divided into extramural, which is like our funding to the external community. We also have administrative activities to keep everything running. And then we have intramural. And so this program is focused on placing students in programs that are interfacing with the extramural community or admin programs. And this is a 10-week program. And we also have a fall fellowship taking place right now because we got it to work so well over the summer with the remote situation. And we have 24 students currently engaged in the program. Like I mentioned, they participate in a wide range of projects through admin, budget, portfolio analysis, databases, ethics, and web design. And if you're interested in learning more about the students and the mentors who participate in this program, we have this really nice campaign, Mentor Monday and Fellow Friday, that our communications team, Aaron and Jackie, has developed for us. And so I'd encourage you all to check that out and hear their stories. We also have another program that I'd like to tell you a little bit about today, the National Service Scholars Program, Data and Technology Advancement National Service Scholar Program. So the Data Scholars is what we call this. And while the Coding It Forward students are really mostly undergrad and some master students, this is focused on bringing in experts to NIH who are further along in their careers. And also we want to bring people from industry. So this is a 1 or 2 year national service program where we place these folks in high impact NIH projects. And we really want them to have computer science or related backgrounds and not necessarily so focused on biomedical backgrounds. And we hope that some of these people will come with industry experience. And we really, I don't know why this keeps happening. We really encourage women and individuals from underrepresented groups to apply to this. And the eligibility requirement right now is a doctoral degree and industry experience. And so we're expecting 8 fellows in the first cohort, and they'll be starting from anywhere between the end of this month to January. And we're bringing them on with a couple of different mechanisms to make this 1 to 2 year position possible for them. So I list the projects here. I don't know, Aaron, if these slides are going to be available, but this shows you where in the NIH the scholars are going to be placed and working. And so you can see there's a broad diversity in the range of projects. And we're really excited about this group, and we're excited to introduce them when they get here. And that's all for me. So I'll maybe we'll save questions till the end. Phil, do you want to take over from there?
Sure. So again, I'm Phil Ryan, and I work in the NIH Office of Intramural Training and Education. So if you go to the next slide, Jess said a little bit earlier that we have 27 institutes and centers. And within those, we have 24 that have an intramural research program. So what intramural means is that this is the research that's actually done on the NIH campuses and is congressionally funded. So about 10% of the NIH budget is spent intramurally, and the other 90% is spent on what we call extramural. But this research that's done within the intramural research program is supposed to be high risk, high reward research that maybe wouldn't be funded at a university. It's a little bit too risky. And so we do some really amazing research within the intramural research program, both in basic and clinical research, and in the new field of translational science as well. And we have campuses all over the place. The biggest and main campus is in Bethesda, Maryland. And we have 2 other satellite campuses in Maryland as well, in Frederick and Baltimore. And then we have a few labs for the National Institutes of Environmental Health and Sciences down in North Carolina, some labs from the National Institute for Allergy and Infectious Disease in Montana, and then some smaller satellite places in Arizona, Michigan, Massachusetts as well. And we have training programs for students and fellows at all levels. So if you go to the next slide real quick here, Jess. These are the training opportunities within the intramural training program. And they range anywhere from age 16 for high school students all the way through postdoctoral training, both from a medical and from a PhD standpoint. I want to put this up here because I want people to understand that with a data science background, it doesn't matter if you're 16 and in high school or in college, or whether you're looking into post-bac work, graduate work, or even postdoctoral work. There's a place within the intramural research program where you can come and you can use those skills to continue to move forward the amazing research that we do. Right now we have a whole lot of data that is sitting in these amazing data warehouses and servers that's just not being processed because we don't have the people who can do the data analytics. And so we need people to come and do that with this biological data that we have. And you can do that at any level. I'm going to focus specifically on a summer internship program that is designed for master's students at the end of this talk, which will be very short since it's not a lot of slides. But I do want to cover all the different areas a little bit more in detail so that you know that you can come to the NIH at pretty much any stage of your education. So Jess, would you take me forward here? Great. So this is the office. Our mission really is to enhance the training and experience of students and fellows here at all the NIH campuses. And we work across the 27 institutes and centers, including working with offices like ODSS to make sure that we are bringing in students from around the world in many different disciplines and really working together in this kind of cross-disciplinary manner that is really kind of the core of NIH research. Go ahead, the rest is kind of on there, but we'll just move on. And where you can find out about the training opportunities is our website, which is training.nih.gov. We have a lot of events that we do for career development, professional development, wellness, resilience, but we also have all of our programs on there as well. We've been opening up all of our services pretty much around the world at this point since we've all gone virtual. So if you are looking for even how to put together a CV or a resume, cover letter, how to network properly, we have all those resources there and they are available to everyone. Go ahead, Jess. So these are ways to train. The summer internship program is the one that we're going to focus on largely, and applications are going to be opening up soon. And I have a child knocking on my office door because I work from home. So if you hear knocking, I'm going to ignore them and hope they go away. But the summer internship program is very broad, and we get about 1,100 to 1,300 summer interns come to the NIH every summer when we're open and not in the middle of a pandemic. That comes from about 3,000 to 5,000 applications every year. So get your application in early and start contacting investigators if you want to come that way. We do have sub-programs, which I'll talk a little bit in a minute. For those who might be graduating from undergrad very soon, you can come as a postbac researcher. It is a paid fellowship at the NIH. It's 1 to 2 years. Again, it's across any discipline, and the idea is that you're coming and getting experience that you need to prepare yourself for the next step, whether it be graduate school, medical school, the job market, whatever it is. Go ahead, Jess. If you are in graduate school, the GPP, which is the Graduate Partnerships Program, is a way that you can do part of your dissertation research if it's a PhD program here at the NIH in collaboration with your university. And so we have about 400 to 450 graduate students at any time at the NIH as part of our Graduate Partnerships Program. And at this point, we've had students from over 100 different countries around the world and universities all over the place. We are working currently to increase the number of master's students who are coming to work at the NIH as part of their master's program as well. And while that technically doesn't fall under the GPP at this point, we are asking that when master's students come, they register with us so that we know that you're here and we can provide you the resources you need. If you're finishing up your dissertation or medical school or some other doctorate, be it a DDS or any other thing, you can do a postdoc research here and bring those skills that you have there to postdoc. We'll skip the medical scholars research program. These are just kind of things. I'm not assuming that we're having a lot of medical students here, but if you are a medical student, yeah, you can come here for research too, because we welcome everyone. And if you're graduating from medical school, be a clinical fellow. We will have you then too. Go ahead, Jess. So this is the program that I think most people came to hear about for me, and we'd love to tell you about. And this is the Graduate Data Science Summer Program, or the GDSSP. So it's a sub-program within the summer internship program. It is 10 weeks long, and it is designed for students who are entering a master's program or in the middle of their master's program, and this would be in any of the data science field, right? So it could be master's programs specifically for data science, computer science, mathematics, computational biology, pretty much anything that fits in with there. We've had students who are getting their degrees in public health epidemiology, who are getting their degrees in statistics. If you can come and use your data science skills to promote biomedical research and you're in a master's program, this is really a great program for you. And so the students come and they use their computational skills to kind of help answer critical biomedical research questions that we hope have significant societal impact. But a lot of times they come in and the students will be working in this NIH research group, supporting research, but also they'll be helping to advance the data science capabilities of the labs as well. So the students who come in through the GDSSP, they learn a lot, but they also teach a lot and really help out the intramural research program while they're here. Next slide, please. So besides that, you also get to, if you can go back one slide, Jess. There we are. We have a customized curriculum in which we actually have a bunch of different professionals who are using data science skills to promote biomedical research, whether here at the NIH or outside of the NIH. And they come and they talk about their job and what they do and how they use their skills. And this allows our students to have a very broad idea of how they can use their skills within the biomedical research enterprise. But it also helps them build networks. So if they want to learn more about that particular profession or want to start looking for a job right away, they can start building the network, which is absolutely essential for that. We also have a leadership development program that's part of the GDSSP. And we usually work very closely with Jess and her fellows in the Coding It Forward as well, for them to be a part of this, where you learn a lot about self-awareness, resilience, conflict management, mentoring relationships, emotional intelligence, and resilience, wellness, and how to take care of yourself and others around you. And one of the more exciting parts is that you get to present the work that you did at the NIH Summer Poster Day, which is, again, a huge event. We usually have around 900 posters where the summer interns get to share what they did for 10 weeks. And the students who are in the GDSSP are a part of that. And they get to go out there and show the great work that they did and how they contributed. And it's for us at the NIH, this is kind of the culminating part of the summer, and we just really love it. And we're real proud of our fellows when they go and present. So, just because I mentioned mental wellness and how important it is, we do have a bunch of different opportunities at the NIH, and I have no idea why that second bullet point has the last 4 words all grayed out, but yeah, we do have workshops, and they're tailored to your trainee level. So if you're in high school, we have workshops that are tailored towards your level, and we have those that are tailored towards postdocs as well. But this is just a few that we think are important, and that if you're at the NIH, you can participate in, and we'd really like to welcome you. I don't think I have any more slides. So with that, we will open it up to questions for myself, or Jess, or anybody else.
Hi, I'm Marion Ben-Dixon. I actually am a postdoc at University of Florida in the College of Nursing. And the question I had is, when you contact the investigator directly, is it generally a funded position?
So are you talking about doing a second postdoc here at the NIH?
Exactly, or some time with an investigator.
Yeah, yes. If you're coming as a postdoctoral researcher, yes, it's a funded position. The investigator of that group will pay you according to a stipend matrix that we have that will determine your stipend. And health insurance is generally provided for all fellows here at the NIH as well.
Thank you.
You are welcome.
So I have the same question for the GPP programs, graduate partnership program. Is it also funded positions?
Yes. We consider anybody who's going to be working here at the NIH for a significant amount of time should be paid accordingly. Graduate students can be a little bit more tricky about who is paid because they're going to be a full-time student at their university while being here at the NIH as well. And there's a bunch of rules and regulations because this is government about who funds what, when, where, and how. But we have a rule here called the stipend parity rule that if you're going to be doing graduate research within the intramural research program, that you need to be paid according to our levels as well. So yes, you would be funded, you would be paid, you would be provided health insurance. It's required that you have health insurance to work at the NIH as a trainee.
So if you have an RA position in university and they pay your tuition, so is that the same for?
Yeah, so like I said, with graduate students, it can be, there's a lot of things to take into account. So if you're already a graduate student, you'd be coming through what we call an individual agreement. And the thing about the individual agreements is that each one is a little bit different than the other. It's very dynamic. And so all those things can be negotiated. There are limits on what the NIH can pay to a university from a stipend standpoint, but it's usually can be worked out. And it also depends on whether it's a domestic university or an international university. And if you want, you can contact me. We can set up a meeting outside of this and we can talk through all the details because otherwise we'll be here for a very long time, taking up all of the time talking about that. So.
It's not for myself. My case is like two years old and 4 years old. Yeah, I'm just curious.
Okay, yeah. Well, if you know somebody, I'm going to put my email address in the chat box here. Have them reach out to me. We can discuss the details of the GPP individually.
Yeah, sure. Thank you.
Mm-hmm.
I have another question. If you're someone looking to expand your knowledge of data science or looking to get more into data science, are there any particular programs, software programs you would recommend, such as R or SAS or things that are good with big data?
Yeah, I think R is a good one. I think a lot of folks in the biomedical research community use that language. And I know that some of the trainers on our team use RShiny a lot because it's good for data visualization as well. Python's another really popular language. I think it sort of depends on what exactly you're going to do. And it also probably depends on what the team that you're embedding with uses. And Jackie's also chiming in the chat. Jackie, you can unmute yourself and chime in if you want.
Yeah, so here at NIH, they do primarily use R, but they usually have people, one of the first things that they teach is Galaxy because that is geared towards the biomedical research community. So if you're looking to just get started out with it, definitely check that out. And then just keep an eye on, I'll pop our website in the chat because we do also list trainings and upcoming events as well.
I have one question for Jesse. So how did you find the hosting essays for data scholars?
I'm sorry, Feng Lao, how did we do what for data scholars?
You find the hosting essays.
Oh, yeah, we had an internal competition. They had to submit projects. We're going through this process again now, and we plan to run the program again if we get enough interest internally.
Okay, thank you.
So,
So we do have half an hour still, and then we are also going to have Jess and Phil available in the Slack channel. I think for Jess and Phil, if you want to give it a couple more minutes, if you want, we can probably adjourn early.
Yes, I have no more questions, and I really appreciate learning more about the data science programs that you guys have. Thank you.
thank you for coming.
Yeah, thanks, Marion.
And I think for Phil and Jess, if you want, you can post your slides into your Slack channel. And I would also introduce yourselves on the channel. And then something that might be nice is to put some of the resources that are in your slides, like the different links that you had, Phil. Feel free to just share those as messages on the GDSSP channel. And then you can also put them in the welcome channel if you want. And that way, if other people will come across them later, maybe they couldn't make it today, but they make it tomorrow, they get a better sense of what's available.
Sure, I'm happy to do that.
So I have a selfish question. What do you guys offer anything for students who already work at the NIH? So I'm an undergrad student, but I work at the Office of Data Science Strategy. And I'm curious if there's any like, what do you have for me?
So the truth of the matter is that pretty much anything that's on our website, you're welcome to attend. I know you're not probably here under a fellowship. I don't know how you're paid, but that doesn't
I'm a
really,
contractor.
yeah. So, I mean, for a few of the things that we offer, you have to register and you have to have a My OIT account, and contractor isn't really an option. So you can just put student and decide on the student you want. If there's anything you want to attend and it won't let you register for, just send me an email. We'll figure it out. Like our general rule when we do things in person is we don't check registration at the door, right? I'm not going to check your badge to make sure you're supposed to be there or not. For students, I mean, there's a ton of stuff, right? So we have workshops on simply planning your career and what that looks like starting as an undergrad, how to find internships, how to apply successfully to internships. It sounds like you already know how to apply successfully to a data science office, which is pretty impressive in itself. But all of the wellness stuff, you're welcome to attend. Anything from a career development standpoint, you're pretty much welcome to attend. And if there's something that you can't register for, just let me know. We'll figure out whether it's something we can get you into or not.
Okay, thank you.
Mm-hmm.
What do you think, Phil? You want to move this to the Slack channel?
Yeah, we might as well. I think so.
Yeah, I think it's just our team, so.
Yeah, thank you both for doing that. I think I'll probably be able to edit out the kind of technical glitch that we had there for a minute. And I think you guys did a good job giving a nice overview of the different programs that are offered. So hopefully other people will find it useful down the road, as well as the 2 people that came today. I mean, I know our staff always finds it helpful, but we got to spread the word.
Yeah, honestly, I find so many people who work at the NIH who have no idea that these programs exist. So I think it's good for anybody to hear, right? Because even this thing that was, it's not for him, it's for somebody he may know. And that's
Exactly.
the word of mouth. It's pretty much the only way we advertise. So word of mouth is good.
Yeah, I believe so. Even for some employee or contractors, and when I was in NIAID, so there are some people. They work in not just in NIH. They work in this area, Bethesda, Rockwell, Gettysburg. They have high school kids, or they have kids that studying universities. So they are very interested to find summer internship positions. And
Yes.
yeah, I have been worked with. I have mentored a few of those. Okay, I don't have any questions. Thank you for answering my question.
Yeah, great. Thanks, Anna.
All right, thank you both for presenting. We'll see you in Slack.
Thanks for
Thanks,
organizing
Aaron.
us, Aaron.
Thank you.
Yeah.
Bye-bye.
And thank you to our captioner.
Yes, thank you so much. Do you want me to spell my last name for you? It's Mazerik. It's all throws everyone off. All right, bye guys.
Bye, everyone.